Good afternoon, everybody. Thanks for being here. Happy Friday, and I hope everybody is doing well. Wanted to come today to provide an update on a few things, and in particular wanted to talk about some important initiatives happening at the Hartford Public Schools, and I'm joined today by our superintendent, Dr. Leslie Torres-Rodriguez. Before I turn it over to Dr. Torres-Rodriguez, I wanted to just talk a little bit more about masks. I've tried to stress over the last couple of weeks just how important and also how easy it is to wear masks, and how important it is because it's how you can keep yourself safe, but it's also how you keep others safe. It's how you prevent yourself from becoming a germ spreader, and we have to acknowledge the reality that with the insufficient number of tests that are being done here and around the country, there are a lot of people who do not know that they have the coronavirus. And the truth is, that could be you. And you want to wear a mask so you don't pass the virus on to others. You also want other people to be wearing masks so they don't pass it on to you. So please, for your own health, for the health of others, and for your loved ones and the community at large, please wear a mask. And I really think it's important to say that when we say wear a mask, it doesn't necessarily mean wear a surgical mask, and it certainly doesn't mean for somebody who's not a first responder or not on the front lines in our healthcare system, it does not mean wearing an N95 or a KN95. Really what we should be saying is wear a face covering. Wear something that covers your mouth and your nose when you go out into public, when you go shopping, when you go to the grocery store. And I think we're all anticipating that that is going to be a requirement statewide very soon. I expect that's the case. I support that decision. And I know that there are going to be some people who are worried about that for any number of reasons. Maybe you're worried about it because you think you won't have access to a mask. But again, a bandana works fine, a scarf works fine, a cloth covering or a homemade mask like the one that I'm wearing works fine too. And my mother made this one, but there are lots of ways to do it, and they're easy to do, but it really is important. And please, do it yourself, spread the word, make sure your family does it, and let's just make it a habit for a while. It's important now as the virus is still spreading throughout our community and spreading much more quickly than any of us would like. But it's also going to be important even when we get on the other side of that peak, as we start to think and talk some weeks from now about what life looks like on the other side of that peak. Masks are going to be more important than ever. So please, wear a mask. And if you have questions about that, feel free to reach out. But there's all kinds of resources out there on the internet now about how you can make a mask or what is a sufficient face covering. But the bottom line is any cloth covering that covers your mouth or your nose will do. You don't need anything special. I want to transition now to discussion about some initiatives at the school system. And first, I just want to say a huge thank you to our superintendent, to our Board of Education, to our team at the Hartford Public Schools, to our administrators and educators at every level and in every capacity. They've all stepped up in a big way at an unprecedented time, and I'm hugely grateful to them, and our whole city is too. As you know, Hartford moved very quickly to distribute thousands of Chromebooks and devices to help families who didn't have those devices get connected into remote classrooms. And a couple of weeks ago, we said that the school system had ordered about 3,500 additional devices. Those devices are now in. The school system is going to be distributing those to families that have not yet gotten a device. It's going to be by appointment only, but that hopefully will help us bridge the gap and get as many additional families as connected as need to be connected. I also want to commend the school system for doing everything they can just to stay engaged with kids and with families. And next week, the school system is going to be launching a really important initiative that's focused on the health and well-being of our kids. Not specifically about coronavirus, but health and well-being in general. And utilizing our school nurses, the school system will be launching a telemedicine initiative where Hartford Public School students can call in and get connected to a healthcare provider. And I think that's a really important and valuable addition to the support that we're providing and the school system is providing to the families and the kids in the Hartford Public Schools. Finally, as you know, the school system continues to sponsor the distribution of meals. Now 380,000 meals have been given out since the beginning of this remote distribution, and that's an enormous undertaking. The city and school system has been partnering together. We've got our rec assistants out there helping, but again, cannot say enough about the partnership and the effort and the work of all those folks who are out there day after day, making sure that our families get access to the healthy food that they and their kids need. So with that, and with a big thank you, I want to turn it over to Dr. Torres-Rodriguez to add some additional information on all those points. Dr. Torres-Rodriguez, thank you.
Thank you, Mayor Bronin. Some updates. We have, as Mayor Bronin said, distributed thus far 380,000 meals. We continue our commitment to make sure the students have access to those meals during the closures. With regard to the devices, it is important that we keep in mind the need to keep ourselves and everyone else safe, and so we have revised the distribution process. We're now going to have 4 locations, and as the mayor referenced, it is going to be by appointment so that our families do not have to travel long distances. Each of the distribution sites is going to be located in one of the 4 school zones that we have throughout the city, and there will be minimal wait. It is by appointment only. And in terms of our efforts to continue to care and connect with our students, it is important for those of you that are watching, if you know a student in Hartford Public Schools, a student anywhere, do encourage them and their families to stay connected despite the efforts that we have done, whether it's been at our, the central office team or the hard work that our school-based teams are doing. Our teachers are trying and staff every single day to connect to students. We still have, from our 19,000 students, about 1,500 students that we have not been able to connect with. And so we care deeply for our students, and we want to know how they're doing, and we want to make sure that they stay connected to their learning. And so our efforts will continue, and which is why we've decided to do 2 things. One is to launch the telehealth services so that our wellness checks that we are already doing can be extended a step further, and if a child needs any medical support, that medical advice is given and provided regardless of insurance status. And also, because we believe about in making sure that the needs of the whole student are met, next week we will also launch our Caring and Connected Response Task Force. That is a group of about 25 partners and providers, including our partners here at the City of Hartford, where we will come together and try to identify the connection that we have to serving specifically those 1,500 students that we have not been able to connect with, and also to provide our families with support that they have told us in these past few weeks that they continue to need around troubleshooting with distance learning. Our parents want to be engaged. Now, some of them are saying, we're home and we want to be embedded and engaged in this process. Please help us. And so we're look forward to developing and then delivering and offering virtual tutorials for our families and academic enrichment, virtual for families and students as well. There are the other piece to the distance learning is, if you remember, the tech-free process, and we have about 500 students that have self-identified with their parent as not wanting to engage in the e-based, the electronic, the technology-based distance learning. And so we continue to extend those resources and supports. And what that looks like is weekly mailings for students, those 500 students, and then also for our pre-K students. They are not accessing distance learning, and so we have mailed out and will continue to mail out about 1,300 packets for our little ones, our pre-Kers.
Dr. Rodriguez, will you be working this summer with the state and USDA to continue the meals throughout the summer?
We usually do offer a meal service throughout the summer as well, so that it complements the summer programming that we have. The thinking that already has started internally is as to what does that program look like in the summer, given that we are not usually able to provide summer programming for all grades. It's usually K through third, and then our summer transition program, and then our credit recovery for our high schoolers. Given the loss that our children are experiencing, we are thinking about what could potentially an expanded summer program look like to offer it across all grades.
And in addition to the meals, will you be using any extended learning programs through the summer? Because the kids are going to be behind. If they don't have some extra catch-up, you're going to have next year every teacher is going to have to go back 6 months and finish what was supposed to be done to catch up to where they should be. So will there be extended programs this summer?
It's a good question. Our students are going to be potentially behind whether or not we do a summer program. So it's yes for the summer program, because we know that even pre-COVID-19, many of our students needed additional support in the summer. And so for us is summer program expanded, and thinking about next year already, because of when I say that there are 500 students that are not accessing via distance learning and another 1,500 that have not accessed at all, we know that we're going to have a lot of variability in terms of the loss, and so it's going to require that we do look at alternatives for our students.
Don't want to throw a spoke in the wheel, but is it maybe time to start thinking about year-round school?
We have a school now, one of our magnet schools, that has extended year, and so they do have, they come a month early and start their school year that way. Research does show that for students that are behind academically, that it's the interaction that they have, of course, in the classroom, right? Being exposed to high quality teaching and learning, and additional supports. And oftentimes, additional supports, they have to happen during some time during the school day, and or extended day, extended year, potentially in the summer.
Helpful to have a school like that, so that the rest of the schools can maybe find that as a resource to help them. If you've got one school that does it and it works, maybe they can help the other schools with hints, tips, direction.
Yeah, I think that's the opportunity that we have in front of us now, right? What are the best practices? What is working? And then the other piece that we can't forget is the resources, right? Resources in terms of, extended day programs mean extended time and people that are necessary. And then also, resources for our staff. We cannot expect that, just like we can't expect our students to step back into the classroom and as if nothing happened. It's the same with our adults, and we're committed to building, the human capital that we have. And so it means added resources to support our teachers in order to make sure that they're able to deliver what our students need, because our students, as we know, experience loss, learning loss, and gains differently.
One more question for you, Mayor, about masks. Mayor Elicker, I believe, has already put the standard down in New Haven. How long are you going to wait for the governor to take some action before you finally say, okay, no more time, now it's time?
So the question was about masks and mandating them. It's my understanding, based on what I've read and some conversations, that I think there is, it's highly likely there will be a statewide requirement very, very soon. Again, I support that, encourage it, and encourage everybody to wear masks right now, starting now. If you're going to the store, you're going out in public, you're riding a bus, you're walking down the street where you might be near people, wear a mask. Not difficult to do, and it's for your health and for others. Look, I know that there are those people out there who will say, but I'm going to take the risk. I don't want to wear a mask, and I'm going to take the risk. Think of this like a speed limit. It's there to protect you. It's also there to protect everybody around you. And so when we ask you to wear a mask, we're not just saying for your sake. We're saying for everybody's sake, for the community's sake, for setting a standard and an expectation that will help us slow down the spread of this virus so that we can all get on the other side of this faster. We don't know when we'll get there. We know we're not there yet. We know our cases are still ramping up. And we know that there are things we can do to affect the outcome. Wearing masks is one of those things. Set? Okay. Thank you, everybody. Have a great weekend. Stay safe, stay healthy, stay home, and God bless. Take care.